I'm ready to go over anything that you don't understand, okay?
Yeah, sir, sounds great.
That's fine. So I think it's 11 o'clock, so we're just about to start, all right? Right.
Yeah, it's fine.
Let's give a few minutes and see if others will join, and then we can start. We have only two people, only myself and you, I guess. Good. So I think, let's say this lectures, you had a bit of understanding within the health and social care, didn't you?
Yeah.
So you understood what we call the Health and Safety 1974 Act, and COSH, Control of Substances, and also reporting of incidences. I'm just going to about to start it because we share every one view as well. Huh? The Weaver's number. You send them that there's someone that's a combat. All right, so Javid, can you hear me now?
Yes, sir, I can hear you.
So today we're going to have a discussion on the Unit 2, and what we seek to
Hello, sir.
hello, say, can you, Joel, can you hear me?
Yeah.
I think it went off, didn't it? Oh,
Sorry?
it did go off because I couldn't see you.
Okay.
That's fine. So can you hear me now?
Yes, sir, I can hear you.
Yeah. So in this unit, it's a learning outcome 2. We have to, if you look down where we have the point 2, basically we need to understand the health and social care provisions for different ages and stages. But the learning outcome that we expect that you outline the points at which health and social care provisions may be required during this lifetime. I'm very passionate about healthcare as a lecturer for the past 5 years, and I would want to talk a bit more and explain things more. So you always have to have any question if you need to. Anything that you don't understand, just draw my attention and I'll go over with you. I'm your lecturer for today and for the next week as well. The 2.2 says describe the health and social care services required and provided at different points during the lifetime. And then the third point that you have to explain you have to explain the arrangement for long-term care provision. And the last one is that you explain how services are assessed at each provision at any point in your chosen country. You know, obviously we are all in UK, aren't we? So UK is our point of country that we have to use. Do you understand it, Joel?
Yes, sir, I understand.
Okay, that's fine. So we have to then proceed. We will talk about the assessment criteria when we are finished the lectures, and we can go through the assessment and what we expect from you guys. Okay. So within 1 minute, I'm going to go back on that, and then we will do that. So we go back to the raw lectures. 1 minute. Unit 2 today. So we have unit 2, don't we? Choose. There we have that. So make sure. All right, can you see the screen, Joel? All right.
Yes, sir, I can see it.
That's fine. So let's proceed now. Now we're going to start the course. So like I did mention, we've already spoken about the learning outcomes. We have to look into structure and overview of the health and social care sector. We have to look at the provisions for different ages and stages, you know, because all we're trying to ascertain is to look into the lifespan for different ages and stages, as I did mention. So the human lifespan varies in different length and terms of experience. There are aspects of development, some are fixed and that some are stationary or some are not stationary. So there may be different factors that affect individuals and their development, whether positive or negative. Of course, a child will be a child, you have to be an adolescent. So there may be different stages, and it's important that healthcare professionals understand these stages, you know, as to how vulnerable children may be or how vulnerable adults may be, and what will be the support that you have to give to them as a support worker, whether physically or whether emotionally or whether intellectually. So the WHO defines health as state of complete physical, mental, and social well-being in the absence of any disease or sickness. So once there's no sickness or diseases, then and health, or we say a healthy person, is somebody who has a complete physical and mental social well-being and very sound. It focuses on reducing mobility and modality and ensures that economic and social conditions or health and social care will be at various stages in life. So the key thing is that as a social worker, you would need to understand the points at which health and social care provision may be required during a lifetime. What stage would healthcare professionals be needed? Obviously, when a child is born, you'd always have midwife, nurses, you have support workers, you have even doctors. So there are stages of when somebody is giving birth, the infancy stage, the early childhood stage. So from 0 to 2 months, the early childhood stage, the later adolescence age. Then we have the early childhood, and then we have the adolescence. These are all stages that support workers may be needed, and therefore we have to understand who is needed at which stage and at which time. Having said that, when we talk about the infant stage, we are looking at the different stages. So the infant stage, when the child is giving birth, infancy or early childhood stage, you always need a nurse, don't you? When a child is giving birth, you need a midwife nurse, and they are health professionals. They are trained to help during your pregnancy or childbirth or the early post-terminal stage. So it could be even before the child is giving birth. You need midwife nurses that will guide you and give you antenatal directions and all that. So they are needed. They are all health professionals. They are responsible for delivering information listed below to women and their family, examining and monitoring the child fetus, understanding and screening tests. You know, when a woman is pregnant, all the antenatal services, the scan, the checks, it is done by the midwifery. So these are key important healthcare professionals within the lifespan or stages of a child or individual. Then we also have health visitors. You know, when a child is giving birth at home, you always have regular healthcare professionals that will be visiting you. One of these are health visitors. They mostly work within the community. It might be a community nurse. They will work within the community. And what they seek to do is that they help regulate families and support workers. And they do is that they help students to make sure that they, 1 minute. Just one, I don't know what's happening. Just 1 minute. They help with families and mostly the children up to 5 years old.
Hello, sir.
1 minute.
Hello, sir.
David, can you hear me?
Hello.
David, can you hear me?
Sorry.
Can you hear me? Can you hear me?
Yeah, I can hear you, sir.
Okay. So then we have the family support worker, and they provide support for families with babies and children who have complex needs. And also competence for work as well as children educational attendance. Then we have the family assessments, and they also seek to assess children help decide the best type of support or service for the child and their family. In addition, there will be a discussion on child's health and development and how they are coping at the necessary at school. So these are all key aspects of family settings or aspect of support workers that play major role from early childhood stage. So those are support workers. They play key roles in the early start use place. David, do you have any question?
No, sir. No, sir.
Are you sure? Okay. So if I ask you, what are some of the, can you mention some of the health professionals that play major role within the early childhood stage? What would you say?
Children and young people process through a number of transit stage in their lives as part of their journey to adulthood.
Yeah, but can you mention some of the professionals? I want to hear names like midwifery, nurses, and all that. You understand what I'm saying? Okay, so let's look at the adolescent stage. The adolescent stage, children and young people progress through normal transition stages. The major transition stage will be 10 to 14 years. There are things that we need to look out to when during adolescence. You know, children are vulnerable. So some adapt to alcohol and substance misuse, being associated with lower academic attainment. So these are things that we need to look to. And there's a need for school teachers and nurses, social workers, community mental health team. They all help to make sure that these things do not and abuse them. Yes. And then we have to, so in the area of adolescence, this transition stage within a child who is growing up and will be exposed to all this vulnerable stuff. There's a need for support workers, school and social workers to play a major role. The local authorities invest in substance-related services providing at different levels of need from schools. So these are all things that needs to be looked into at that stage, you know, and the major role of support workers, social workers, and the school nurses help in making sure that adolescents do not go overboard. Then we have the mental health and well-being. Adolescents, critical period of young people's mental health well-being. You know, so their well-being is also very important. You need mental health nurses to help. And those who become homeless, becoming homeless can be very devastating emotional experience for family. It may encompass feelings of loss, separation from friends and family. So these are key things that we need to look into. We need to really look into that as well. Then we have childhood and obesity. Health and social care professional can play supporting children with their weight and pledges. Of course, most nurses do that. Even when a child is giving birth, you see nurses coming there and ensuring that those within these sectors or within this are normally giving support. So they'll come to your home, they take the weight of the child to ensure that they don't become obese. All right. Joel, I'm the only person here with you, so we can interact. Any question at this stage?
Sir, can you say me that homeless once more? I didn't understand. Sorry.
Okay, so I'm saying children, let me go back. When a child is going to become homeless or becoming homeless, it's very frustrating. So it affects their emotional. So let's say if a family are going to become homeless and they have children, the children will go through frustrations. You know what I mean? And this
Yeah. I
cause
mean that losing your family and the friends separating from their.
exactly,
Yeah.
exactly. So the children will go emotional because if you have problems or maybe you are moving from one house to another, it creates frustrations for the children. You understand? So they need support workers to come and help them, to guide them. So the council have support workers, social workers, mental health nurses. So support workers are needed at this stage as well, whether they are becoming homeless or whether they have obesity or physical problems or whether they lack mental health well-being. Support workers are needed. It could be social workers, it could be community mental health team, it could be school nurses. Do you understand that?
Yes, sir. It means that if a child needs an help, they are separating from families and friends. They have a lot of stress, and we have to contact and we have to give them a counsel and a good advice to them. Is that correct?
Exactly.
Thank you, sir.
Okay, thank you. Then we need to look at the early mid adult stage. And at this stage, early childhood is extremely a diverse period of life. It comprises a wide range of lifestyle choices and responsibilities. Some people launch directly into any adulthood at the legal age of 18, while others take a much more prolonged course. Change is always stressful, whether it is good thing like marriage or having a child, or a bad thing like loss of relationship or a loved one. So in a period of life that is full of change, there are many opportunities and challenges. So it's a bit complex when children are growing because they are stage between an early stage and the adolescent stage, and they need support even from their parents. You understand me? They need support
Yeah,
in
I understand
guidance.
that
Exactly.
in 18 years of they are losing their relationship and all. It means they have a lot of stress and all.
Exactly. So they need support. Children need support when they are growing to adolescence. They need support, and the support is not only um, social workers, but even from their schools, their teachers, and even from their parents. So this is what we're talking about. And then we have the difficult, so early child, it's difficult coping with emotions, with anger, sadness, anxiety. They can be exposed to alcohol and drug abuse. they can be exposed to academic or employment difficulties. You understand? They may have family and discord, diseases. They may have marital issues if probably the parents are marital or difficulty in finding a romantic partner. So these are all things that creates stress. You know, the stresses of this time period can worsen pre-existing conditions. So a child may go through all these stages as you are growing adolescents, your academic problems, employment problem, not getting a job, 21, 22 years, you're not getting a job. It can be frustrating and they need support. So in the UK, they have the Citizens Advice Bureau, who is there to help and guide people. There's so many NGOs that is available to help guide because they understand that people go through a lot of mental and adolescents go through a lot of mental and emotional situations. And support workers are there to help in this situation. Then we have to look at the late adulthood. The late adulthood. Just 1 minute. Let me check something. Then we have the late adulthood. It is considered as the late from the time reached out mid-16s until death, because you are living longer. The late adulthood is getting longer. A 10-year-old child today has 50% chance of living up to 104. So what could be the support services that will be available? The variety of charities that have set up support services such as Age UK. Age UK help towards all those things. Handy person services, food care, transport, dementia support, they all help. Even the NHS also provides access to a variety of services such as social care workers, community nurses, GP, dental, hearing, and optical care, care homes, and carers where required. So there are a lot of organizations that help. The NHS, community nurses, your GPs, they all help during this stage and support. And these are all support help professionals, you know. And we also have to look into other NGOs like the camps. These are camps that stand for Children Adolescent Mental Health Services. It's a free service run by your local NHS. It's made up of medical and mental health professionals. This type of care is known as home care or domiciliary care help. Also support with cost of medications, help to maintain and cope with long-term medication conditions. It depends on the person's abilities and the level of care and support they receive. Children and young people with learning disability may also have special educational needs, support for learning disabilities, and family carers. Some learning disabilities are diagnosed at birth. Others might not be discovered until a child is old enough to talk. So there are some of the issues that confronts adolescents. You can discover them a bit earlier, some not. So support workers play a major role in helping to diagnose some of this ailment or anomalies that children may go through. It's very important that these things are identified by support workers. It could be emotional and it could be also intellectual issues. Then we have to look at end-of-life care. End-of-life care is when somebody has been declared, whether HIV or any other, has been declared that is going to die. And normally old people, it could be any other person, they need support. They need support, you know. So that support is always done by healthcare professional. You know, healthcare professionals. And you have to have the skill. You have to be trained to be able to know how to need. So somebody who is going down might say that probably nobody should touch him, or when he dies, they should burn into ashes, or his comfort, or it doesn't need medication. So there are things that we need to know as healthcare professionals. And these are key areas that care professionals play a major role. people are dying, need care in 4 areas. They may need physical, they may need mental, emotional needs, and even spiritual needs. You know, services include GP. Preventive healthcare deals with prevention of illness to decrease the burden of disease associated risk. Hospital and social care, mental health services, all these play major role within the lifespan of people from childhood to adulthood. And then we have the long-term care, also known as social care. And I explained that yesterday. They may be required when individuals become ill or suffer disability. That means they are unable to care for themselves, with the probability that their disability will continue over a long time. So these are, it could be older people, it could be somebody like a grandfather, and they are ill for a long time, so they cannot do nothing on themselves. So you need carers to be assigned to their homes to help them in terms of cleaning of their self, feeding, and many other things. So we call them long-term care provisions for individuals with long-term health condition and disability. It could be somebody who is crippled. It could be somebody who cannot do things by himself. It could be somebody who has a dementia issue, you know. So long-term care can also refer to a broad range of medical and social service options that are available to meet the needs and compensate for the functional disabilities of persons of any age. By this care, most commonly serves the elderly who can no longer function independently. Okay. Yeah. Javid.
Yes, sir. My name is Jewel, actually.
Oh, there's Javid have joined as well. Javid,
Yeah.
can you hear me?
Yeah, I can hear you. I understand long term care. It means in any age of people have any distribution and all, we have to contact the GP and they will give us advice and all.
Say it again, Javid. Say it again.
And you say that a long term care.
Long-term care, yes.
Yeah, it means people long term care may be required when individual becomes suffer, or that means we have to care themselves with the probability and disability will come over the long term and all. It means broad range of medical and social care service. The people of the age became some care most commonly served that they earlier who long functional independently in UK.
That's fine. Okay. That's fine. So, but the key thing is that when people have long-term conditions, Javid and Jewel, it means that they may not be able to do things on their own. You understand? So you need people to help them. And the people that go to help them, they are health professionals. You understand me? You understand me? Are you guys there?
Yes, I am there.
Yeah. So the key thing is that because they have long-term condition, which is, it could be disability, it could be cripple, it could be a lot of things. So they cannot do things on their own. So there's a need to have some people to step in to help them. And these people are what we call health professionals. You understand me? So it will be support workers. They'll be in their homes to help them, to make sure they can do things on their own. Some of them to feed them, to help them go to the toilet, to help them to bath. You understand me? So these are what we call health professionals. Do you understand that? Then we have to look at care in the community. You know, because you need to have nurses within the community and healthcare professionals. So you have care, a strategic vision of describing a healthier future. The key aim to support an increased number of people to live independent lives, preferably in their own homes. To do this, ACS, the health needs to develop effective alternative to hospitals care. So when somebody is discharged from the hospital and they come home, like those of you who have children, you know, when your wife has a child and they discharge them to their home, you know, normally some nurses come from the community to visit you. Do you remember? Do you know that? Don't you? So you have people from the community to visit you. We call them community nurses. They are there to provide the needs and support you to recover. So these are all people that are available within the community to help. Then we have domiciliary care. In domiciliary care, it is a care that is provided so dom care, you understand me? Dom care, so they provide all these things in terms of putting in place to make sure that the person's risk assessments are met. So a person may be discharged from the hospital to his home, and because he came and not mobile, is not mobile, they have to provide support workers to come to you maybe in the morning, in the afternoon, and in the evening. Morning, afternoon, evening. So morning, you might need somebody to help him to wake up from the bed, to give him food and to give him medication. In the afternoon, you need somebody to come there, maybe to take him to the GP or give him his lunch. And in the evening, you have somebody to pass by, also to help to put him to bed, help him with the medication, to bath him. And the person have very serious, complex needs, like catheter care. When you say catheter care, those who may have urine bag. Some people have urine, they pass on urine through a pipe connected to them. There's the bag that has the urine in. So you need to help them to discharge that urine bag. They cannot do it on their own. Stomach management. Somebody who has stomach. Some people go through toilets through their belly. They cannot go through the toilet through the normal way. So there's something that is cut off and they put a bag on their belly. It's called stomach. And that needs to be discharged. That physics needs to be taken out every time. And you need somebody to do that for me, or peg feeding. So you need people to help them, and support workers play a major role in helping them. Then we have to look at institutional care. That is the most common form of long-term care. Early child disabled care, able to interact people with having 24 care to that. Institutional care also has a type of residential care for large groups of children. It is categorized by one size or fit approach according to which same service, so it's also provided by a large organization that is mostly comprised of nurses, nurse practitioners, doctors, therapists. So this is more like the NHS. Elderly and disabled are able to interact together with also having 24-hour care to daily necessities. So 24-hour care, it means that there is care at any time, morning, afternoon, evening, 24-hour care. But they need that, because they have complex needs, so they need to have 24 hours care. Then we have other services within the UK, the direct contact made by itself, access to services. Within the UK, access to services throughout each provision is done through the following: access to service aging, direct contact made by self, calling your GP or calling your dentist yourself, or private insurance that we spoke about yesterday, or social services. It could be a social issue, safeguarding issue, or educational establishment. If it's an educational issue, you contact educational establishment. Then what could be the barriers to accessing services? There are different factors that prevent individuals from gaining access to health and social care early years service. It may be that they do not know about the services. Barriers to services: regional, social, economic, and policy barriers. So there may be regional barriers, there could be social barriers, there could be economic barriers, and there could be policy barriers. So these are all that may affect a chance of someone to be able to sort of ensure that they can access this information. And we have to analyze those barriers. So when we say the regional barriers, some individuals live near health and social care and early years services, and others may live distance away. So if you don't live close to your GP, you can imagine if you are not well and it's emergency or you have to travel very far. For those individuals who do not live near services, they may find that the buses in the area do not run at a convenient time to get an appointment, which is true. A patient may need to have specialized treatment, which is many miles away, and find it difficult to get there. Finding it difficult to travel to the services because of distance is a geographical barrier. Some individuals may find that due to this mobility problem, they cannot walk a short distance to the health social care. So it's a problem. If your GP is very far, it's a problem. It becomes a barrier, or your hospital is very far. It becomes a barrier because you have to travel very far to go to your GP. And so these are factors that we have to look into when we are trying to refer people to sectors. You have to look at where the person lives and the nearest hospital, the nearest GP in terms of registration. If you live in Longside and your GP is in Salford, it's very far. If you are not well, it's very frustrating for you to get an appointment to travel very far to Salford. Then we have the social barriers. It could be psychological. It could be psychological barriers. The barriers affect the way individuals think about the service. It may be that they have a fear of dentists, okay? Or if an individual feels unwell and they are worried about finding out what is wrong and they may not seek from GP. So these are psychological barriers, They are things that probably they don't want to disclose and all that. So these barriers can affect their way of accessing information. And financial barriers. This will do with how much it might cost or access a service. In health and social care or early years service, the individual is trying to access as it comes distance away. They may not be able to afford the transport cost to get there. If a patient has to pay for medical prescriptions, they may not be able to afford it, so they do not get the medicine they need. So financial barriers, of course. If you are not getting government support, the SAS2, for prescriptions, then obviously people are not able to afford to pay for costs, and therefore they wouldn't want to even go when they are ill and all that. So these are barriers that may affect financially. Then the economic ones, it could be resource barriers. Sometimes health and social care and early years services, individual needs to access may not be able to dwell staff due to staff shortages or lack of money for the service. If there's a large demand for a service, then people may have to wait until there's sufficient money to pay for all those that need the service. Also, there may be high demand for vaccination against diseases. So people may have to wait until sufficient vaccine has been provided, because the country may not have sufficient. So they may have gone bankrupt. Sometimes health and social care and early years service an individual need to access may not be available due to staff shortages or lack of money for the service. So it may be that just recently, Birmingham City Council went bankruptcy. So the NHS may be faced with a lot of issues financially, and therefore they lack the financial resources to employ more nurses to work. And so these things may contribute. This may be factors that we have to look into. And we may also have the policy barriers. Policy barriers, in terms of several policy barriers that need to be overcome if integrated care systems are not able to establish more widely. Policymakers should explicitly recognize the need for competition in some areas of care and collaboration in others, and should develop competition rules accordingly. So in policy, several policy barriers need to be overcome if integrated care systems are to be established more widely. Policymakers should explicitly recognize the need for competition in some areas of care and collaboration. So in policy making, you have to look at where you can collaborate, and it's very important. It can be also an issue that one needs to deal with. But while we have to look at solutions, in solving these barriers or these problems, so examples will be transport provided, house visits, pop-up clinics. So people who cannot work, who are disabled, we can have the nurses go to them in their homes, or what we call community nurses. We can have GPs visiting them, rather than they traveling from far. And with the social, to account for it, or to introduce a buddy system where patients can access services with a trusted person, explain steps or procedures. Then we have resources, distribute resources, vaccinations on a needs basis to most vulnerable first. So you look at those who need these vaccinations and distribute them to them. And policy, we have to look at adapt policies to reflect current needs and requirements and adapt a person-centered approach. I keep on saying person-centered approach is very key. But we have to look at needs that reflect the requirements of the service users or the patients, you know, and we adapt policies that will suit them. All right. So if a person cannot work, we have to look at the policies that will suit people disabled, where we can have some cars to pick them from their homes, or have a transport provider manage with them and pick them from their homes. These are all policies that we have to look into to make sure that the needs of the people are met, rather than the general way of looking at things. All right. Okay. So Javid, any question? Joel, any question? Hello.
Hello. Yeah.
Any question, please?
It's okay for me. Yeah, that's good.
Is it Joel or Javid?
It's Javid here.
Okay.
Thank you.
Joel,
Yeah, sir. It's okay for me also.
are you sure?
Yeah.
No questions at all. No questions at all.
Yeah, sir. It's good.
Okay, so today we had a look at, and I want you to read about them. A look at the points at which health and social care provision may be required during a lifetime. The health and social care services required and provided at the different points during a lifetime. Arrangement for long-term care provision. How services are accessed at each point in your chosen country. Barriers to access to provision at different stages of life. How barriers to access are being overcome. Okay, we looked at this, and then these are the references that you can look into. Age UK service in your area, long-term care, domiciliary care, community care, barriers. So these are references that you can look into. Okay. So if you have no questions, then we can let's look at the assessment criteria there. If you have no questions, 1 minute. So let's look at assessment criteria. Can you see the screen? So you are expected to analyze barriers to access to provisions at different stages of life. Okay. Analyze the barriers to access different stages of barriers in life, and that is merits. And if you want to get a distinction, you have to assess how barriers access are being overcome. So you look at the barriers, and you have to look at also the solutions or how you can overcome them. So this is the assessment criteria. All right. Are you guys there?
Yeah, it's okay.
It's okay. All right. So I think if you have no questions, Because I mean, we are almost done. David, I thought you were going to ask any question, but you've not asked. So if there's no question, then we have to go back and read, and we expected to have our assignment 2 weeks from now when we are done. You need to look into the long-term goals. You have to look into the barriers that affect people and the solution that you can overcome them. Should you have any question at all, you can always email us, and then I'm ready to reply at any time. Okay. All right. When do you have the next lectures? Do you know? Hello?
Hello, yeah, that will be on the next Thursday.
Next Thursday. Okay, that's fine. That's fine. So see you next Thursday then, okay?
Okay, thanks so much.
You're
See
welcome.
you.
You're welcome.
Hello, sir.
Bye. Thank you.
Joel.
Sorry, sir. Next Tuesday, there's assessment.
Yes. Next Thursday. I think we have unit 3 as well.
3.
Yeah, 3. Yes.
Test paper like that.
Yes, level 3, and then learning outcome 3. Then we're going to finish everything.
Sir,
Then you have to,
how do I do the test on like on site or what?
say it again, please.
This you will pass the link on WhatsApp.
Yes. We send it on WhatsApp. Yes.
Okay, sir.
For next Thursday. Okay.
Or only today's lessons are there on next
Yes,
Thursday?
today lessons as well. Yes.
Yeah,
We share the recordings as well. Yes, everything. So we're going to finish on Thursday, the last learning outcome 3, and then from there we need your assignment to be submitted 2 weeks from that. Okay.
Thursday 11 a.m. Or like that.
Yes, still 11 a.m. Yes.
Okay, sir. Thank you.
We'll send you the Zoom details and everything. Don't worry in advance. Okay.
Yes, sir. Thank you.
All right. Thank you. Bye.
Thank you. Bye.
Bye.
Thank you, sir. Take care. Bye. Hello, sir.
Hello.
Sir, I have a question also. Sorry for that.
Okay, go ahead.
Sir, there's attendance going on.
Say it again.
Attendance means attendance. Class
Assignment.
attending. No, assignment not attendance. Classes attending that my our names are there.
Your name is wrong, you mean?
No, it's correct.
So what's the problem, please?
That what means I that attendance.
Attendance.
Yeah, it's
Okay. Yes, it's very important.
yeah. Today and yesterday I got in my class.
Your class.
Yeah.
You have to attend lectures. Yes.
Okay. Thank you, sir.
You're welcome.
See you.
See you. Bye.
Sir, can I leave?
Yes, you can leave.
Thank you, sir. See you.
Bye.